Hey guys, it's me, Beanie. I'm back with part 2 of week 2 of no permanent dentures, courtesy of Aspen Dental. So where we left off on video 1 was that I received a phone call from the regional manager following up on my complaint to corporate. She basically said, tell me your story. I said, didn't corporate tell you? She said, yeah, but you tell me. Sure, because that's what I want to do. I want to relive my trauma from last week's video. And here's the thing. You know what, guys? When I say trauma, I literally mean trauma. Having all of your teeth extracted, it's a part of your body. It's a necessary part of your body. That's no less traumatic than losing a toe or losing a foot because you have diabetes. Losing a body appendage is losing a body appendage. Whether it's voluntary or involuntary, it's still a loss and it's still traumatic. So it should never be minimalized or marginalized. And so for those of you who have emailed me and said, you know, people don't think that I should take it as seriously as I have or been so affected as I have. I'm telling you, I'm on board with you. Nobody would dare look at a diabetic and be like, oh, you lost a foot because you had diabetes, or someone who was in the military and lost a limb, or someone who was in a car wreck and lost their eye and had to get a glass eye. No, what they get is empathy. They get empathy and sympathy. But the minute that somebody mentions dentures, dentures are automatically correlated with poor hygiene and mismanagement of your health. You didn't take care of your teeth, you lost your teeth. You didn't brush your teeth, you lost your teeth. And the truth of the matter is, for at least 40% of the people who get dentures, that's not the case at all. For the people that have polyuria or genetic issues, or have taken medicine, chemo treatments, cancer radiation that have eradicated their teeth, there is a number of reasons. People with OI, which is brittle bone disease, they lose their teeth. There is 1,000 different reasons for people to get dentures. And I feel like denture patients really should be treated the same way as anybody who had any other type of amputation. You know, maybe start thinking about it in that respect. Like, it is an amputation. How many of you, when you got your teeth pulled out, still had the phantom thumping pains in your mouth? I had the phantom teeth pains for months. I still get it once in a while up here. It's not like a nerve. It doesn't hurt. It's just like phantom tooth. Like I still feel like I have teeth sometimes. Anyways, we'll talk about that another time. So she makes me retell my story. Then she says, I see that you have an appointment set up for this day and this time. Well, you're in luck. I was scheduled to be at this office anyways. Sure you were, darling. And I'll be there so I can, basically, I'll be there to, provide or lend support in any way I can. I get there this morning and you guys, I was not received. I've been going there for 9 months and several times where I had to come every week for 2-3 months at a shot. I have never had a reception like this. I was literally on the shit list. So here was the punishment for making the complaint. So you see how they had this complaint line, but now you're on the shit list because you're not really allowed to complain. They want you to be customer satisfied, but not really satisfied. like we offer to remake your teeth, but we really don't want you to complain that you don't like them. What we do is we want to rotate you in and out like cattle, get you in and get you out and get your money, and we don't want to see you again. It was very obvious I was on the shit list. The girl, she took my temperature, didn't even ask me the COVID questions, said in a very stern voice, like after she pulled up my information, you can take a seat. Like and it wasn't me looking into it. I know how to be bipartisan. In my line of work throughout the years, you have to learn to kind of, straddle the fence, right? So I don't take that shit personal, but it was so obvious. And then at one point, the one girl picks up the phone and kind of like, she must have called back to him or somebody and said, so-and-so's here. Like, I'm here. Eventually, the little girl came to get me. Now, it's 8 o'clock in the morning. It was only me and this other broad who was crying her eyes out in the office. I was there like as soon as it opened. There was nobody else there. The little pregnant girl came and got me. And this time she brought me to the room where they pulled out my teeth. That's not where I try in teeth. Okay, so the regional manager lady, she didn't come into the room until 20 to 25 minutes after I was been already sitting there. And I said, I should have at least brought my computer with me, because I was like, there was so much work for me to be doing. And I thought it was going to be like any other time where I was going to be in and out. And already, because I felt like I knew this was going to be a disaster. Like I just knew I should not even have gone today. Right. Like, I'm like, if they told me originally that they couldn't do shit with these teeth, now all of a sudden they could, nothing good's going to come of that. And they don't seem to think it's a problem that you can see through my gums. So whatever. So she comes in, she says, hi, I'm, regional manager so-and-so. I talked to you, I think on Tuesday, right? I said, uh-huh. She says, oh, okay, well, I just wanted to come in and say hello. She said nothing. Because understand this, darlings, this regional manager, she's not there for you, the customer. She doesn't work for you, the customer. She's not there for customer retention. She's not there for customer support and loyalty. She works for the corporation. She is the liaison between the franchise or the branch, whatever you want to call them, or the office, and the corporate office. That's who she's the liaison for. She's not there for you, the customer. I know that. So I wasn't surprised. She then walked over to the counter. She picked up my teeth, which were in a plastic Ziploc bag, looks at them through the teeth. She rolls them over, looks at the other one, plops them back in the box, and she walks out. I don't see her for the remainder of my visit. Oh, thank you so much, regional manager. You're so wonderful. What a great support for someone who's been traumatized. He finally comes in. He says, well, let's look at these teeth. And he immediately tries to fluff me. His people skills need a lot of work. So he tries to fluff me, meaning he's trying to distract me from looking at the actual teeth, like seeing the problem. And he doesn't want to give them to me so I can look at them. And here's the other thing too. I just realized they didn't give me the bib or anything. Like normally when I come and I have to take out the teeth, they give me a bib and they give me a tissue to put my teeth in. I got nothing. Like that's how shitty they treated me. Like you are a redheaded stepchild. We don't want you here. I just realized that. I got nothing. No bib, no napkin. I had to take my slobbery teeth out and put them in my lap. So he tells me, I had two technicians working on this. Let's see how this is. How did you have two technicians working on this, sir? You only have Bob that work in this office, and you guys called me the same day that I was there, and I'm sure you did not call in a second technician just for me. The other thing was he made sure to tell me that they added the custom detailing to help the transition between the gums and the teeth. Well, first of all, Aspen Dental, that's part of your initial package. And it wasn't in the first set of teeth. So the fact that I had to complain to your corporate, I only complained to two people about that. I complained to corporate and I complained to that general manager. That was after he supposedly already repaired the teeth. Or, patched them or did whatever. So this custom sculpting was then a third treatment to the teeth. Because I didn't mention that to them when I first saw them. I didn't say, oh, where's my custom sculpting? I just said, why don't these look natural? Like, why don't they look natural? So he wanted to put them right in my mouth. And I said, no, I want to look at them first. And the minute I looked at him, I was like, oh, sweet Jesus, why did you even waste my time coming here? Why would you not only embarrass yourselves, but just humiliate me? You know what it is? It's just so they can tick the little box on their paper and say that they did the bare minimum for customer satisfaction is what it is. They're truly not interested. Like, your satisfaction is our guarantee and whatever. First of all, this is a multi-million-dollar, probably even close to $1 billion company, depending on what they have their assets diversified in. Okay. What they spend to make these teeth, even what they spend to make the comfy lights, is marginal compared to what they charge. And that's because they buy on volume. Okay, so everything is on volume that they get at a very discounted rate. So their overhead is not what you think it is. And yet they just, okay, anyways, let me not go off on that. Okay. So I looked at them and I said, these are worse. They're worse. And by the way, I'm going to insert pictures of last week's teeth with what they look like today. So you can see that you can still see through the gums. Now it's actually worse because they added bulk here at the gum line. That piece of bulk adds an additional shadow that draws attention up here. And then he did something, so it kind of looks like, you know what it looks like? Now I just thought of the word. It looks like ombre. Like how much of the tooth you see through the gums is like an ombre effect. It's awful. And the pictures that I have to show you guys are not even the best pictures because you remember it's in that yellow light. How they looked in person was, or I should have used my flash. I didn't use my flash because they didn't want me taking pictures. Like when I said, can I see those teeth again? Because I need to take pictures. And he was very like at this point, he hates me. I wasn't going in there with hate in my heart for anybody. You know, I'm surprised that there was no empathy for me last week. Like, how could you guys look at that and think that that was okay to give somebody teeth with see-through gums? That's not passable as this here is more passable as a natural tooth than to give somebody a tooth that's got see-through gums, or to give them a palate that has see-through gums. There's no way that's a natural palate. And you would want me to walk around with that? Like, you have to understand your customers are your advertising. If I would have walked away with even a moderately decent set of teeth, even if they looked like this, but just in a smaller plate, I would probably be singing their praises. If they looked like my wax try-ins at the final, I would be on here right now singing praises. But I can't do that. And they don't even care because to them, my money ain't, my money ain't shit. For every one of me that they lose, they've got 10 more people who don't have insurance that they are not only making money on the teeth, but they're making money on selling them the financing. They get a kickback on the financing. We talked about that before. So they offer all these different financing options through their partners. They get a kickback. So for every one of me, who cares if you don't like it, Beanie? Who gives a shit if we don't do what we promised? Because we got another 10 suckers who are going to pay full price, and we're going to be laughing all the way to the bank. I'm going to Vermont. I'm going to Bermuda. Where are you going, Beanie? You're going down to Tijuana to get your teeth. Do you know what I'm saying? So they don't care. Everyday Joes like you and I have no consequence. It's not about we'll remake your dentures or give you your money back. I'm asking you to remake the denture. You have my molds there. Okay, so if it's the Comfy Light, then offer me another option where you're not going to see the teeth through. They didn't even do that. There was no option for that. Would I have been happy with that? No, but would I have considered it? Probably, just because the thought of now I have to pay more money because I no longer have insurance. I then have to find a dentist, and that's going to be a whole nother ordeal because I already went through the interview process before, and that's when I had insurance. Now I have no insurance. So I have to find a dentist. I have to find a dentist I can afford because I have no insurance. I'm now going to have to tell my boss it's going to be another at least 8 weeks of me needing an appointment once a week to do this process all over again. My boss is going to flip the fuck out. You know, I mean, all of you that work, you know, your employers are not trying to hear, yeah, you can take a little time off here and there. I've been having to take a day off a week since, well, I did it in January, then I did it all through from the middle of February to now the end of March. So for 6 weeks from February to March, I've had to take the mornings off once a week. You only have so much latitude with employers to do that. And then top of that, with the fact that I have PTSD and anxiety, the thought of having to do all those things is so overwhelming when I thought that this was already taken care of. And just the mere fact that they just won't replace the teeth. So I said, this is awful. And I was very quiet in the office. And I just said, no, this is bad. Like, this is really awful. I mean, look at this. And I put them in, and as soon as I went to smile, all you saw now is fucking bubbles all along. I mean, so far from a natural look. If it doesn't scream Beanie has dentures and poorly made dentures, I don't know what does. I don't know if it was like a punishment almost, like because now Bob is just upset with me insulting him and insulting his level of work. And now everybody, obviously in the office, is being nasty to me and rude to me, and like segregating me. So was it to make them look super shitty? So like, listen, just make them shitty, because then she won't take them. She'll leave and she won't come back. Like, that's what it comes down to, right? So I was dumbfounded, because I thought with this lady coming, she would see the teeth and say, no, we're going to remake them. Like, no, you guys, we're not putting our stamp on this shit. $1 million company or not, we're not putting our name on this. We're not letting this lady walk out like this. No, she didn't do that. Not at all. Not at all, you guys. I didn't even see her. Not at all. There was no sympathy. There was no empathy. There was no hugging. There was no, we're sorry you're so upset. It's like, go fuck yourself. You just wasted all this time with our company. We didn't even give you what we claimed to give. And there was never any disclaimer saying, you have a very unique mouth. I don't think we can give you dentures that look good. If I would have never said anything about having the translucent gums, they would have let me walk out of there with those translucent gums, non-custom translucent gums, and never thought twice about it. Because there's no quality. Like, they don't really care about quality. What they say is, yeah, we want you to be happy, but we're only going to give you this much room to be happy and make complaints and want. If it was about something simple, like, when I'm complaining about how the tooth is shaped here and how the bottom was, I almost even get it. But this is so erroneous. To see the teeth through the gums is just beyond reproach. It's abhorrent. And how that's acceptable. How anybody would put their John Hancock and say, yes, this is our company's product, is beyond me. And so I just said, I was crying again, and I just said, I can't accept these. And I said, and you won't remake them? And he said, no. He did not give me a reason why he would not remake them. He didn't even say, oh, it's because you got the wax try-ins. No, he didn't say any of that. He just said, no. He said, you can get a refund. You can take the teeth. He said, or if you want, you could try to go to another Aspen Dental, but I'm not sure what they could do for you. That's how he said it, right? So when you hear that, what do you guys take away from that? When somebody says, you can try another Aspen Dental, I don't know what they can do for you. I'm not sure what they can do for you. What does that tell you? It's like, well, then you can try it, but I'm telling you right now, they're not going to do anything to help you. How disheartening is that? How, just knock you off your seat. Like, what am I supposed to do now? The lack of sensitivity was just disgusting. I hope his mother never has to go through that. I hope, listen, I want somebody at Aspen Dental to tell me if they would wear those teeth. I promise you, if they had no teeth and somebody said, here, this is what you're going to wear, they would be very heartbroken being told to wear those teeth. So I said, well, I can't make a decision right now. I'm going to have to think about it, because I was too upset. I was literally going to fall out in tears. And then I left. And nobody said anything to me. And that was it. I get home. I'm trying to do work. I can't focus because I'm so upset. And now I'm like, now I don't even know how much more money this is going to cost me. And like, if it's not one thing, it's another, right? So I'm like, oh my God, like, what am I going to do? Like, what am I going to do? And what am I going to do about my job? My job is going to fucking have my ass. I called this customer service number. Again, if anybody needs Aspen Corporate's customer service, who basically, I think all they do is they get the complaints and then they delegate the complaints to the regional manager. And this is why I'm telling you this. The number is 315-454-6000. That's 315-454-6000. Extension 201-791. So any of you that are Aspen customers, and if you ever need direct number to corporate, there it is. So I called that number. I got the girl's voicemail this time. And so I left my voicemail. I didn't even get to finish it. That's how long-winded it was. And about 2 hours later, I got a phone call from the Anderson office. So I knew, I'm like, ugh. And it was that lady, that regional manager. And she says, I know you said that you wanted some time to think about what you were going to do, but I got an email saying that you wanted a follow-up call about today's visit. I said, yeah, but not from you. I said, I wanted a call from corporate. She says, I am corporate. No, you're not. You work for corporate. You're not corporate, sweetheart. You're not. Okay, you're a regional manager. You're not corporate. But maybe you're confused about what that means. And I said, okay, well then I want whomever is above you. Because she was there at the office. She saw me leave because I saw her in this back room, I think it's like a file room. So she saw that I left. She never made no attempt to speak to me. She made no attempt to resolve anything. And she obviously felt like the quality that they were giving me was okay. Like having see-through gums is okay. See-through gums, you guys just know this. See-through gums at Aspen Dental for their highest quality dental dentures is approved. It's okay. It's natural. It's not natural. I said, well, I want to talk to your whoever's above you. And she says, well, that's Dr. So-and-so, and they're in Jamaica. And I said, okay, well then have them call me when they get back from Jamaica. And then she was trying to like talk me. And I said, I don't know why. I said, I don't want to talk to anybody right now. Like, I'm really still upset. Well, obviously now that I start talking to her, I get upset again. And I said, listen, lady, I have like so much work that I have to do, and I can't do that and be upset. You know, like I just can't. Like I can't focus on my work and be upset about these teeth. And she's shucking and jiving. And I know she's there with the dentist, and they're probably talking on like conference, or he's listening in or whatever. Because a couple of times when I asked certain questions, and I said, why is it that nobody wants to remake these teeth? There's nothing wrong with the bottoms, but why won't you remake the top? Is it has to do with the shape of my mouth, or does it have to do with the product? I'm not getting a clear answer. I said, first, I'm told it's because of the shape of my mouth. Then I'm told it's because of the product. Then I'm told it's because of how I wanted my teeth, which that is a complete exaggeration, and they need to stop it with that. And that still wouldn't even answer why all of the teeth are translucent. If it was how you had to set these because of the way the front palate comes out, what's your excuse for the ones in the back? That don't make no sense. So you can either be very honest with me and say, you know what? While we're okay with people saying they don't like things, we don't want to deal with you anymore. You know, we don't want to help you anymore. We want to turn away your service because we lack the skill set to make teeth for you. Again, you guys, if you had see-through teeth, what do you think? Would you be okay with see-through teeth? So take a look, do me this favor. Take a look at the pictures. You let me know. And I want your honest opinions, you know, whether you're subbies or not subbies or whatever. I want your honest opinions on if you feel I am being too hyper emotional about the look of translucent gums. And then not only the translucent gums, but the bubble gums. Now the bubbles they added on top of them. I mean, because if I am, then I'm open to revisiting looking at this. Because quite frankly, even if I had to go to another Aspen Dental, which is another 40-minute car ride, guess what, you guys? I have to start the process all over again. So I still have to take time off of work. It's still a crapshoot. So why aren't they being honest with me? If it's the shape of my mouth, then why would I even go to another Aspen Dental? If you're telling me this trained technician can't make it and it's because of the way my mouth is, why would I go somewhere else? You know? So you guys, listen, take a look at the pictures. You let me know what you think. You let me know if you feel like I'm being extra about it. If I'm being unreasonable about $2,000 dentures that are supposed to be top of the line, natural looking dentures. If I'm being unreasonable about the fact that they're see-through. And I am sure I'm not the only person in America with the mouth shape that I have. And if I took you guys, you see how loose those are? These are so big, it's not even a clear representation of how small my mouth is back there. So to say because it's the shape of my special little tiny mouth, it's all a deflection. It's a deflection. At this point, they have decided that they have extended enough energy on this person. It doesn't make any sense for them to want somebody to be happy with their product. They would prefer that someone have complaints about their product and voice the complaints about their product instead of doing the right thing for customers. It's very clear. It's very clear. It's very upsetting. And I can only imagine how many other people go through this denture process and have the same thing. Like you can't say that you don't like it. Because just be happy you have teeth. And how I was treated today, how I was segregated and everybody was just so icy to me. I have never had that experience in that office. You guys have seen video. I'm very kind of loud and boisterous and fun. Yeah. I mean, she all but said, he's just not going to make any more teeth for you. But that's not what I was told last week. Like last week, I was just told they were not going to make it. Not because he refused to make the teeth. Just that they were not going to make the teeth. Not like it was a personal issue that he didn't want to make teeth for me anymore. It's just they weren't going to make the teeth. I signed off on the wax tries and they weren't going to make the teeth. So take the teeth that we're giving you or take a partial refund and go somewhere else, motherfucker. So keep all of that in mind for those of you. I mean, I've been getting so many emails of those of you that are just starting your process. You know, I'm not saying that every Aspen Dental branch is like this, but if you have an issue, just know that you have no support from the corporate level. Corporate does not give a shit. You're an ant. They don't care. Give them your money or don't, because for every one of you, there's 10 more suckers coming who do not take the time to educate themselves that they could get their dental work cheaper somewhere else. That's the truth. All right, guys, take a look at that. Let me know in the comments below what you think of the teeth, and I'll see you in the next video. Bye.